Okay, good morning. Today I will discuss the General Administration Guidelines of the WRAT 5. So there are 4 sub-tests, and these are the word reading, the sentence comprehension, the spelling, and math computation. Part 1 of spelling and math computation subtest can be administered individually, and the part 2 of the spelling subtest and math computation subtest can be administered in a small group form. Next is sentence comprehension subtest. This subtest is closed procedure participants and silently reads the sentence from the sentence comprehension card and then gives an oral response to fill in the missing word. May use the place marker as an aid prior to actual subtest items. The participants takes 2 or 3 sample items, the sentence comprehension sample card, determining the starting point for both sample and test items by using the Part 2 word reading raw score and conversion in the table of front test form. Next is spelling subtest. This subtest pronounce the word, then read it in the sentence provided. Then, pronounce the word again, then study the pronunciation guide provided before the administration. Then, check that the participant is writing incorrectly numbered space on the response form. And after administration, ask the participants to clarify any words that cannot be read. Part 1 is letter writing. The part 2 is the spelling. Next is math computation subtest. The math computation subtest has 2 sections. The part 1, oral math, which consists of the 15 items. Then the part 2, math computation, which consists of 40 items. It may be administered either individually or in a small group for participants 8 and older. But it must administered individually participants ages 7 years old and younger. Okay, this is my end of my discussion in general administration guidelines in WRAT 5. So, you can start now.
For this lesson, we will tackle the WRAT 5. So first, what is WRAT 5? The WRAT 5 is an efficient, easy to administer, and psychometrically sound assessment of foundational academic skills. WRAT 5 stands for Wide Range Achievement Test, 5th edition. The WRAT 5 provides an accurate and easy to administer way to assess and monitor reading, spelling, and math skills and help identify the possible learning disabilities. The WRAT 5 evaluates skills relevant to learning, job readiness, and functional academic skills and has uses beyond the classroom settings. The history of Wide Range Achievement Test is in 1946 with 1978 Norm Up, WRAT R in 1984, WRAT 3 in 1993, WRAT 4 in 2006, and WRAT 5 or the 5th version has released in 2017. Next is, who developed the test? The test was developed in 1941 by psychologists Sidney W. B. Joe and Joseph Jastak. This teacher is Sidney William B. Joe, was an American developmental psychologist who developed an approach of treating childhood disorder using behavioral therapy in which positive actions were rewarded and negative behaviors were largely ignored rather than punished. There's no picture of Joseph Jastak in Google, but Dr. Joseph Jastak is a psychologist who was a pioneer in the testing of people with learning disorder and a founder of the consulting firm of Jastak Associates of Wilmington. There are 2 authors of Wide Range Achievement Test. The first one is Gary Wilkinson, PhD, and the second one is Gary J. Robertson, PhD. A norm reference test that measures first is word reading. It measures on-time letter identification and word recognition. The examinees read aloud a list of letters or words. The second is sentence comprehension. It measures the ability to identify the meaning of words and to comprehend the ideas and information in a sentence using an on-time modified closed procedure. Each item requires the examinees to read aloud or silently a sentence with a word or 2 missing, and then provide a response to effectively complete the sentence. The third one is spelling. It measures an individual's ability to write letters or words from dictation without a time limit. And last, the math computation. It measures an individual's ability to count, identify numbers, solve simple oral math problems, and calculate written math problems with a time limit. Provides are presented in a range of domain including arithmetic, algebra, geometry, and advanced operation. Administer individual or group. WRAT 5 administration of tests is usually done individually, and specific subtests can be done administered in group. Alternate forms of tests designated blue form and green form. These are the blue form and green form examples. And this form can be used interchangeably with comparable result, allowing for retesting within a short period of time. To prevent the potential practice of effect of repeating the same items, the alternative forms can be administered together in a single examination. The WRAT 5 administration and scoring in option. In administration, the first option is paper and pencil. The second is Q interactive. The scoring option is hand scoring and Q global. Second is Q interactive. In hand scoring and Q global, it helps you quickly and efficiently organize examinee information, generate scores, and produce accurate and comprehensive reports. And Q interactive options, it is a comprehensive digital system that can be used to administer and scores the complete WRAT 5. There are scores available. The first is the standard score, percentile ranks, stanines, normal curve equivalent, grade equivalent, and growth scale value or GSV. And qualification level is level B. In age range for the test is broad. We're looking for a wide range here and looking for 5 age year all the way to 85 age plus. So it allows us to use one single measure not across a large or wide barrage range. So in completion time, ages 5 to 7 years old is approximately 15 minutes to 25 minutes. In ages 8 years old and up, it approximately time of 35 to 45 minutes. WRAT uses screening for: first is identification of people at risk for learning disabilities. Second is academic skills in reading, writing, and in math. Third is educational placement. Four is data contributing to a neuropsychological or psychoeducational evaluation. The fifth one is determination of disability. The sixth is assistant for determining skill set acquired versus emerging skills services. 7 is for morbid functioning. It varies for the conditions. 8 is using a forensic evaluation. 9 is growth or change over time. 10 is vocational training or job placement. And 11 is level of care at home support.